Our dais right now is Shipra Dawar, who will talk a bit about what we did with mental health.
Thank you so much for this opportunity to be talking about the work that the government is doing with startups in the space of mental health. I think it goes beyond me, the fact that as startups, we today have a stake and a place to work and bring an impact with the government was unheard for startups like us. So thank you so much for this initiative and all the work that the government has done, not just for mental health, but across fields to bring in startups innovation to make the difference. I run one of the India's first in leading mental health startup during 2020, when the pandemic was in its throes. The government and the ACT, it was because of ACT that the government reached out to startups like us to create mental health interventions and reach the last mile. Through the pandemic and with our work with more than 12 district and state governments, we were able to provide mental health solutions to more than 5 lakh individuals in this country. And these included people like migrant laborers, ASHA workers who were completely despondent with the crisis that had been unfolded onto them, the COVID patients, the families, the people who were struggling because of the economic slowdown that had hit them out of the blue. During the pandemic, we saw what WHO always said, that more than 300 million people in India are suffering from mental health issues. And mental health is actually one of the top crises in the healthcare sector that the world faces today. The government actually recognized it, and in the 2022, was visionary enough to bring the tele-mental health policy. I must say that I'm doing a course in Harvard of leadership for mental health champions, and they globally recognize that India's policy for mental health is the best in the country, and the US is only emulating this now. So that stands for the testament of what the government is doing to enable mental health solutions like ours. And this was the policy that enabled the formation of IWill, which is IWill Care, which is a digital screening tool completely based on AI, which not just understands what a person may be dealing with clinically, but also the social determinants behind it. It could be a farmer struggling with a loan who's a single bread earner in the family. That could be triggering the mental health condition. And those screening points go very, very important, because you then not just solve the clinical problem, but the government has the data to bring in more solutions that solve the root of the crisis that there is. We also build in completely AI conversational based tools to actually help people with therapies. Mental health is an expensive service, and AI enables you to cut down the costs of that service to 1/8. The good thing is that ACT supported us with the funds for that. Microsoft has recently supported us with the funds for that, but also the technical know-how for that. And we've already started to build this in Marathi. We are doing a small pilot in the district of Yavatmal with bringing in screening tool for the farmers who are destitute because of the issues that they have faced, but specifically mental health concerns, and then bring in interventions which are already existing in the state through the digital platform IWill Care to the people who most need it. The reason why a startup like mine is working in the heart of Maharashtra is because of the e-governance, because of the regional governance of the government of Maharashtra and the national government. Our startup aims to bring mental health care access to everyone, and I would say that it enables because of the good policies that this government has, both at the center and the state. And Shaunik ma'am was very instrumental in our journey for scaling eSci Clinic's solution through MSINS at that time in 2020. So special thanks to her and to Sandeep. And I hope that we, after this session that we had, we stop taking mental health care less seriously. It's the foundation of our health, and it's as important as the physical health. The government is doing everything necessary to make it the equal sister of healthcare so that our citizens are healthy, and can live their life to the fullest potential. Thank you so much.
Yeah, thank you, Shipra. I think one point that Shipra made, I think it's true for all the other startups as well, is that language usage, making sure that we can support these solutions in local language is a big thing. And this is one thing that I have to give a lot of credit to our Indian entrepreneurs, right? So the Indian entrepreneurs, I think Rudra mentioned this, that, they are building solutions for India. And part of that is the requirement that they have to be done in our local languages. And that's what, is very important when the government is involved, right? It has to be local language. So I think partnering with local entrepreneurs who are building solutions, that's a big advantage as well. So thank you once again for all your time. I know we have the next session and we're running a little behind, but thank you for your attention.
Thank you very much, sir. I request all of you to be here for some time for a photo, and I request Srimati Radhika Rastogi, Joint Director, NBSNNA, Masuri, Uttarakhand, and I request her to felicitate the chairperson and the panelist. Srimati Radhika Rastogi. Sonia Soman ma'am. Rudraditya Bhattacharya. Sanjay Vijay Kumar. Shipra Dawar. Thank you very much. And ma'am, please be here for a photo.